Hi, my name is Dr. Nkiru Kachuba.
And I'm Dr. Erin Gregg Newman.
And together, we are co-directors of the UCI School of Medicine's Prime Academy. At UC Irvine School of Medicine, it's our mission to reduce health disparities in Black and Latino communities throughout Southern California. UCI School of Medicine has become a leader in addressing these disparities by offering 2 mission-based programs in medical education, also known as PRIME programs. Our first program focuses on Latino health and the other on African, Black, and Caribbean populations. These programs are the first of their kind in the nation and have established UCI as a pioneer in medical education regarding the underserved.
I wanted to join the summer program after working as a volunteer at a pediatric orthopedic institute, primarily providing care to underserved youth in Los Angeles. In this role, I realized that I really wanted to be an advocate for others, and I knew that the PRIME program would provide me with the tools and the skills in order to make a difference.
My most memorable highlight of the program has to be learning about everyone's stories. It really shows me how everyone's different. Everyone's journey is always going to be different, and I from everyone's story, I take a little bit out of it. So it's like things that I see that are going to help me along the way. I'm going to use them as well.
So for me, one of the most memorable moments was Dr. Paluzzi's workshop on patient-centered care. He told us to focus on the 3 C's when we're trying to find our place in medicine, about being calm, confident, and courageous. So as a current applicant, those 3 aspects are very hard to continue as we're making our way through the process, but hearing his insights about not only being a provider, but also being a patient at one point in his life, and seeing both sides of, bedside care, and helping tailor our own experiences to make sure that our patients are feeling welcomed, and then also our providers help make our patients feel welcomed by balancing both the roles of being a fixer and a healer.
I saw that they were going to do a lot of the clinical work and experience of simulations, and that really drives me because I'm obviously, to be here, I'm interested in medicine, but they showed that you would have some hands-on experience and getting to be in real life simulations. So that really interested me, and that to me was awesome.
To establish a strong pathway to our programs at UCI, we are proud to present the UCI Prime Academy. The UCI Prime Academy is a week-long, scholarship-based experience for pre-medical, undergraduate, post-baccalaureate, or graduate students who aspire to address the health needs of African, Black, Caribbean, and Latino communities. Scholars will gain knowledge, skills, and experience that will advance their ability to champion social justice and foster health equity. The Prime Academy team has designed an interactive and engaging curriculum that comprises 4 main pillars. Medical exposure. Our program exposes scholars to clinical topics and teaches scholars practical clinical skills. Our program gives access to the renowned UCI Medical School Simulation and Clinical Skills Center to allow students to interview standardized patients, practice medical resuscitation, and learn various procedures such as suturing and ultrasound. Application preparation. Whether you are just starting to think about a career in medicine or are ready to apply to medical school, the Prime Academy offers intensive workshops in the application system, including personal statements, secondaries, interviews, and finding schools that match your needs.
Health equity. Scholars will investigate health disparities plaguing vulnerable populations and consider actions we can take as healthcare professionals to bridge gaps in health equity. Mentorship. The Prime Academy is committed to providing longitudinal mentorship with current medical students, residents, and faculty physicians that will walk you through the application process and help you to achieve your goals.
I saw this program and I was like, this is exactly what I want to be a part of. I love to give back, and I want to kind of just give back the mentorship that was shown to me, because I know that it's hard to find mentors, especially as minority students. And so I think that's just a really important thing to me, and that's why I wanted to be a city director for this program.
What motivated me was because I didn't have many mentors growing up, especially during college when I needed them most, preparing to get into medical school. So I felt like this was a great opportunity to provide that type of support for students who might also struggle in finding a mentor.
If you are passionate about serving underserved communities and are considering a career as a physician, We invite you to apply to the UCI Prime Academy. We can't wait to meet you.